Hi, Dr. Tony Mork here. Today I'm going to just review some of the risks and complications of a cervical laminoforaminoplasty. Chances are you've got some cervical stenosis or a cervical disc herniation out the back, which is symptomatic and causing some shoulder and arm pain. And the treatment that I've recommended is a laminoforaminoplasty or just a foraminoplasty. I just want to point out what this actually means and what we'll be doing so that you can ask any questions that you want to about this if you have any. Laminoforaminoplasty is a procedure in which a small tube, 16 millimeters or less, is directed down to the facet joint here, and then a portion of this facet is removed to gain access to the foraminal canal. This is the foraminoplasty part of the operation. Also, if there's any large disc fragments in this area, sometimes they can be retrieved. The second part of the operation is actually opening up a portion of the central canal where the spinal cord is located in the event that there's any type of central stenosis. They do not have to be performed together. They can be performed each one as needed. Certainly the risks of this type of operation, of course, are infection. Anytime an incision is made in the skin, one can have an infection. However, after doing over 1,000 cervical endoscopic procedures, I have never seen an infection from the backside, and simply because the blood supply back here is so excellent. The second thing that could happen is there could be some bleeding, and usually the vessels here are small and usually not a problem, but bleeding is also a very small and rare possibility to be of any type of problem. The third type of thing that could occur here is a nerve injury. The benefits of endoscopic surgery is having a direct view of everything. However, when trying to get the disc or the disc fragment out or the nerve actually adequately decompressed, there can be some dysesthesia post-surgically, and by that I just mean some areas of numbness that can last for a while, usually in the 6 to 18 month range, usually improving with time. Although other nerve injury is possible, but again, very rare. The last type of complication that can occur is a dural leak. Sometimes if something is indenting the dura of the spinal cord, or if a section of the exiting nerve root is actually, if some bone is pulled off and some of the dura is removed, there is a possibility of a dural leak. This is usually treated with some type of repair intraoperatively, and they're usually very small. Again, quite rare, but it is a possibility. The other injury that can occur, although I've never seen this, and that would be injury to the vertebral artery, although this would really take some again, very rare. I've never heard of it. I can only just mention it for the sake of being complete. Well, I think that's about it. I guess the last thing, it's not really a complication, but just a possibility, and that is that doing this operation will not give you complete relief of your symptoms, whether it's pain or weakness, which is always a possibility. Once a nerve has been compressed, and the longer it's been compressed, the more likely that you would get a possible incomplete return of either sensation, reduction of pain, or return of motor strength. Okay, well, thanks a lot. This is a good time to ask any questions. Once you've seen this, the idea is to give you an informed consent. And if there's anything that still you have a question about, this is a great time to ask me. So appreciate you watching this, and we'll be talking to you soon. Thank you.